talk. The next talk is to be presented by none other than Dr. Vikash Talreja. He is a consultant at Regency Hospital, Kanpur.
Thank you, Dr. Akhil, and congratulations to all the organizers for an excellent conference. Apologies for not making it to the physical thing, but then the virtual is always the best mode. Today I will be discussing the Empower 150, the key subgroup analysis of the patients with EGFR mutations or the baseline liver metastasis. The most sought trial, probably I would say. We'll go back to the study design. Next slide, please. I suppose. Can you share the slides with? Perfect. So second slide, please. Yeah. So it was a stage 4 recurrent metastatic non-squamous non-small cell lung cancers, chemotherapy naive patients who were stratified based on their sex, PD-L1 expressions, and liver metastasis. The three groups were the ABCP arm, the atezolizumab, carbopecli, and bevacizumab. That was the arm B, followed by the atezolizumab maintenance. The arm A was the ACP arm, that is atezolizumab, carboplatin, paclitaxel without the BEV, and the third was without the atezolizumab with the BEV maintenance. And when it was presented in ESMO 3 years back, the PFS was significantly different. Next slide, with a 1 year cutoff of 37% progression-free survival in the ABCP group as compared to the BEV plus the CP group, with a median follow-up of around 15 months, which was significant at that time. In those with a T effector high subgroup, again, the ABCP arm performed by a significant margin with hazard ratio of 0.5, 50% reduced risk of events in the ABCP arm. Next slide, please. And in those where the arm B and C were compared with the progression-free survival, you could see that the benchmark figure of 8.3 months without the progression in the ABCP arm. Now, in the AACR 2020, the final analysis was portrayed for and was presented by Tony S. Mock in that subgroup. So the final analysis was, next slide, please. Next. 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 Yeah. So the ABCP versus the BCP arm, the overall survival, there was a hazard ratio of 0.8, which means there was a 20% reduced risk of deaths when you give the with a median overall survival around 19 months as compared to 14 months. And the curves, look at the curves, they were outrightly separated throughout the initial crossover. And now also in the ACP arm, it was seen that the median was 19 months as compared to 14.7 months with a hazard ratio of, again, 0.84, meaning a 16% reduced risk of deaths. Now, the overall survival was consistently maintained and the graphs were quite remarkable. Next slide, please. The slide which was the focus 3 years back, as those with the baseline liver mets and those with the EGFR mutations, where we were struggling with the therapy, this continued to outshine, the hazard ratio being 0.6 with a clear-cut difference between these curves, with a median of 29.4 months in the ABCP arm as compared to the BCP arm, where it was 18 months. And similarly, the overall survival in the as compared to the ACP arm, where you could see that the curves were exactly similar. So for those with the EGFR mutations, the ABCP is the thing to carry forward to. Simply atezolizumab with the pacli carbo combination isn't effective as compared to the BCP arm. So the quadruplet clearly outshined as compared to the triplet. And also in the liver metastasis, again, the quadruplet had a significant hazard ratio, nearly 33% reduced risk of deaths when you give the quadruplet as compared to the triplet. And if you look at the next slide, the PDL1 subgroup in the similar subsections, the ABCP arm again had a clear-cut advantage. And in the PDL1 positive, if you the atezolizumab, you see the ACP arm also had a similar advantage. The hazard ratio being 0.73 and 0.71, meaning a 27 and 29% reduced risk of deaths when you give the immuno bev combinations. So that taken together, everybody of us know the ABCP regimen, the toxicities associated with it. Last 4 years has given us some experiences of handling these patients, and this trial was shown to be effective in the key subgroups of the liver metastasis and the EGFR sensitizing mutations, where the quadruplet clearly outshined the triplet. Opportunity, and back to the
Thank you, sir. That was really helpful. So we'll be moving on to the next